This week, State Attorney General Letitia James ordered NYU Langone to reinstate its trans youth gender-affirming care program or face legal action. NYU Langone, one of the city's largest hospitals, abruptly ended the program last month after the Trump administration threatened to cut off Medicare and Medicaid funding to hospital systems that provide gender-affirming care to trans youth. Mayor Mamdani condemned the move in a post on social media, but he has not yet taken further action. Here to break down what all of this means is the only transgender member of Mayor Mamdani's Health Committee. Abby Stein is here. She is the author of Becoming Eve, My Journey from Ultra-Orthodox Rabbi to Transgender Woman. Welcome to the program. Good to see you.
Thank you. I do want to do a quick correction. I don't think I was the only one. I think I was the one specifically working on gender-affirming care. That was my role on the transition committee.
Okay.
But I'm not sure I was the only. I'm fairly certain there were a few more.
Okay, fair enough.
Just to be clear.
Well, let's start by making clear what we mean by gender-affirming care. What specific kinds of medical support do transgender patients need?
So I think what's most important here for this conversation is they need what their doctors and therapists say they need. And I think that's what we need to center in this conversation. No one comes into this, wakes up one day and the next day goes to the pharmacy and gets pills or hormones or procedures. This is a process that is done by consulting doctors, by consulting therapists, by making sure that both the mental health and the physical health is covered. So that is what needs to be covered, and what they need access to is whatever their doctors say they need access to. Most of the time, the most common one are puberty blockers, which very importantly, what it does is reversible. And more importantly, the difference first in health, and specifically the difference in the rates of suicide, which is unfortunately something we need to talk about when we have these conversations, is really, really big. And not having access to those, which are sometimes as little as simply blocking puberty, not doing anything else, is literally a matter of life and death. And I'm not saying this to be intense. It is a reality.
Okay, so would you have wanted to use those services?
I wish I knew about it. It would have been, my life would have been infinitely easier. I mean, I think by now probably would have been the same, but to be able to do that at age 12, 13, 14, I had, and I describe it more in my book, we said we're going to keep profanities to a minimum on the show, but I described it in my book. When I was 4 years old already, I tried to take matters into my own hands in ways of, I didn't even know what trans means, but I knew what I was feeling. So kids really sometimes know at a young age. And again, by consulting with their doctors, consulting with their therapists, consulting with the people around them. And when those people say that this is what needs to happen, whether it's a puberty blocker or even further care, we need to listen to them and we need to make sure that they have access to that.
About how many kids would this affect in New York? Is there an estimate?
I think there are some numbers. I don't have the numbers offhand, so I don't want to say something, but I would say it's a few thousand. I personally have met dozens of kids. I was on the board last year of something called Transformative Schools, which is a school specifically for trans youth, just as a social program. And that school alone had dozens of kids. I have met so many. We have done for the past 2 years. The mayor actually came to one last year. We did a rally for trans youth, and we hear from those kids directly.
So now when the federal government, the Trump administration, has threatened to cut Medicare funding, Medicaid funding, other federal support to hospital systems, and NYU does what? Because they still have a transgender practice. They're just saying, what, young people below a certain age can't
Everyone under 19. So for some reason they decided not even 18, so not even just people who are legally underage, but even 19 for some reason. And what they really do, what is so threatening, is that they threaten Medicaid for everyone.
Sure.
So it's not just, let's say if NYU continues providing care, the federal government is saying, I'm going to take away Medicaid from trans youth or even from trans adults. I'm going to not allow you to process Medicaid whatsoever, which is really dangerous for so many people and impacts the most vulnerable, as we all know. And what's so important also for us, and I think this conversation that we've been having, and since the beginning of the transition when I was on this committee, and until now, specifically with the Deputy Mayor on Health, these conversations that we're having a lot is we want to make sure that we protect the access that we have for trans adults, which NYU and Mount Sinai and all those hospitals are still doing. I mean, I can say it openly, I'm a patient at Mount Sinai, for example, and I've had a really good relationship with the doctors there and with the providers. And we need to find how do we make sure that that access keeps going? Like Medicaid at the moment does cover for adults, which is the law in New York State. But by New York State law, they also need to cover for trans youth. And how do we make sure that that continues to happen?
Okay. I sense, even just from talking with you, what the outlines of a case by Letitia James might look like. Because threatening a program over here in order to get a name over there doesn't always really work out legally. But what should City Hall be doing? I mean, we have 11 public hospitals, and I think Mayor Mamdani has suggested that they might be a place where some of the medical gap could be filled, right?
So at the moment, and I think this has really been the struggle, and I think a lot of people in our community, myself included, have been very frustrated. We want to see more happening, but I'm also inside City Hall to say that I know the struggle that we're having of trying to balance those, because in some ways we could come down. We can say by New York City, by New York State law, these hospitals, at least the public hospitals, but also NYU, they, like the letter of the Attorney General said, you have to cover it. But at the same time, we need to make sure still that we can do both. Yes, there's the New York Health and Hospitals is definitely a path. It's something, that conversation that we keep having on how do we make sure and how do we perhaps fill that gap. At the same time, there's several other plans, some of which I don't think are ready necessarily to be shared yet, but something that that the city administration is working really intensely on to be able to fill that gap. And I will say I've heard that from the mayor directly on one-on-one conversations and in the statements that he has made publicly, that this is a priority, to make sure that we fill in the gap. Exactly how it looks depends on this game that we have to unfortunately play with the federal government to make sure that we both protect trans adults, we protect trans youth, and that we protect all the other programs for elderly New Yorkers, and we all know, as soon as they can, they will try to target HIV and PrEP. They're gonna try to target everything they can until they get what they want. So we need to be smarter than that. And we need to make sure that we fill in that gap, which is a strong priority. We don't throw anyone under the bus, and that we keep what we already have.
Yeah, and I mean, and just to be clear, before we say goodnight, the reality is any medical treatment that young people want, their parents have to give consent, right? You can't just walk into a clinic and even get a flu shot if you're 13 years old. So this is not just about the youth. This is about the youth and their families and their parents who are looking for this care.
To say a language that I think the right loves to hear is parental rights, because these are all kids that are coming with their parents. I mean, besides 18 and 19-year-olds, which are also being targeted. But for kids, yes, these are parents who have consulted with doctors and with therapists and with teachers. I know personally so many kids, no one makes this decision easily. And by the time we get to the fact that they have a prescription or that they go to a doctor, taking that away from them is attacking the kids, it's attacking their parents, it's attacking the professionals, the mental health and physical health professionals who have done the work.
Okay, thank you for bringing us up to date. You hear so much about this, and we normally just report on the rallies and the protests and the lawsuits, but this is a great inside look at what is going on. And best of luck to you. Thanks for coming in.
Thank you so much.
Okay, that was Abby Stein, and that is going to do it for tonight's show. Thanks so much for watching, and have a great evening. We'll see you next time inside City Hall. If you want to keep up with what's happening in New York politics and hear more conversations with the people shaping the future of New York and beyond, subscribe to our channel. And let Spectrum News be your resource for balanced, in-depth political coverage, elections, and issues that matter to you.